Okay, I'm gonna do my head to toe assessment, and I'm gonna start by just scanning the room. All right, and I do have a note card that I'm gonna use at the end. I'm gonna put it off to the side. Okay, first thing I will do is knock on the door. Um, knock on the door to enter the room. Sanitize my hands and close the curtain for privacy. And then I will start with her general overview. So looking at her, I can tell that her skin is good for her ethnicity. She has good posture because she's sitting upright. I know that she has gait and mobility because I noticed her when she walked in. Her mood and affect are calm. She seems to be well nourished and have good hygiene as well. Okay, so after that, I will check her orientation. So can you tell me your name?
Tarika,
Can you tell me what year this is?
2020,
And can you tell me where you are?
doctor's appointment.
All right, patient is oriented times 3. Next thing I'm going to do is palpate her head and face. Do you feel any tenderness?
No.
She does not feel any tenderness, and I do not feel anything abnormal. And looking at her head, I can tell that her scalp does not have any flakes. Her hair is shiny, and her hair also has a good texture. Now I'm going to palpate the frontal and maxillary sinuses. Any tenderness?
No.
Okay, no pain, no tenderness. Next thing I'm gonna do is ask her to do some things to check her cranial nerves 7 and 12. Can you wrinkle your forehead, clench your eyes, clench your teeth, smile, lick out your tongue, do it side to side. Okay. Her cranial nerves 7 and 12 are intact. Now I'm going to go to her ears. So first I'm going to palpate her her pre and post auricular lymph nodes, and I'm also going to palpate her ears to make sure that there is no tenderness or anything that's abnormal like lumps or masses. And then I'm also going to palpate her mastoid area. Any tenderness?
No.
Okay. There's no tenderness on her external ear. Any tenderness?
No.
No tenderness, no lumps or anything. And now I'm gonna do her mastoid. Can you open? Close. Her mastoid area does not have any tenderness, any edema, or any nodules. And now I'm going to look inside of her ears to check for any drainage or lesions in her auditory canal. Okay, there's no drainage, there's no lesions, everything seems to be fine with her ears. Next thing I'm going to do is go to her neck. Her neck is aligned, her neck is symmetric, her skin is good throughout, and there are no lesions. And I've already palpated her neck, and now I'm going to palpate her her cervical lymph nodes. Cervical lymph nodes, there's no masses, no tenderness, no lesions. Carotid artery, carotid pulse on each side is 2+. So next I will go to her eyes. So for her eyes, I'm going to check her cranial nerves 3, 4, and 6. Okay? Can you follow this without moving your head? Just move your eyes. Okay, so cranial nerves 3, 4, and 6 are intact. Next thing with her eyes, I'm going to check and make sure that she has perla. look out here. Back right here. Okay. So the patient does have pearler. Her pupils are equal in size and shape, and they accommodate and react to light. Now I'm going to check and make sure that everything is good with her eyes. Okay. So her conjunctiva, sclera, iris, and corneas are all clear with no lesions or drainage. Also, her cranial nerves were intact, the 3, 4, and 6. Next thing I'm going to do is her mouth and throat. Her lips are smooth and hydrated, and they're pink. Open your mouth, please. Okay. Looking inside her mouth, her teeth are white and smooth. Her hard, soft palate, floor of her mouth, buccal mucosa, tongue, and tonsils are all pink pink and smooth, with no dental caries anywhere, and her tonsils are +1. So now I'm going to do her nose, and also her ears were aligned, intact, and symmetric. Her nose is also aligned and symmetric, and there's no lesions. And can you do the patency test? Take one nostril, breathe down. Other one. She has patency in both nostrils. Okay, so now I'm going to move to her chest and lungs. First, I'm going to take a look at her thoracic cage. Okay, her AP diameter, it has a ratio of 1 to 2. And now I'm going to listen to your breath sounds, 6 in the front, 6 in the back, and 3 on each side. Where's your arm? Still. Okay, all her breath sounds were good. Where's your arms? Now I'm going to palpate her axillary lymph nodes. Any tenderness?
No.
No pain, tenderness, or masses with that. I have to check her breath sounds in back, 6 places. Okay. All right. Next thing we will do is her heart. I'm going to list the 5 sounds. First sound I'm going to listen to is aortic. Second is pulmonic. Third will be Erb's point. Fourth will be a tricuspid. Fifth is mitral. All right. She has good rate and rhythm. There was no splitting, and there was a presence of S1 and S2. No presence of S3, S4, or any murmurs. Next thing I will check is her abdomen. How you lay back? Okay, so her umbilicus, yes, is midline, is contoured, and the color is equal with the rest of her complexion. I'm going to listen to her vowel sounds in the 4 quadrants. Our vowel sounds were good. I did not hear anything abnormal. Now I'm going to palpate. First I'm going to palpate light, then I'll palpate deep in each quadrant. Light, deep. Right, everything's good. You can sit up. Next thing we're going to do is muscle strength. When I press down, press up. Okay. Muscle strength is good. Also going to do her range of motion. Can you move your head to the side? Left side. Back. Okay. Next time that you do it, I want you to press up against my hand. Up. Next side. Side. Back. Okay. Her muscle strength and range of motion is good. Now we're going to go to her cerebellar function. So what I need you to do is touch your nose and then touch my finger like back and forth as fast as you can. Nose, your nose, my finger. Yeah. Okay. Next thing I want you to do is take your hands and back and forth like that. Okay. Next thing we're going to do is light sensation. I need you to close your eyes and I'm going to touch you and tell me when you feel me touching you. I feel it. I feel it. Feel it. Feel it. Okay. Light sensation was good. She felt every area that I touched. Next thing I want you to do is the Romberg's test. I want you to just stand up. So put your hands to your side and close your eyes. Okay. Romberg's test is negative. Okay, you can open. Next thing, I'm going to have to step right here and turn around and bend down. I'm going to check out your spine. Her spine is symmetric and aligned. All right, you can stand up. So her spine is symmetric and aligned. Have you sit back down real fast and take your heel of your foot to your shin and go back down on each side. Okay, other side. All right. That's part of her cerebellum function. She was able to complete that task. And now we're gonna move on to her musculoskeletal. Okay, stand up, please. I want to have you stand back there, and I want you to walk across the room normal. Come on back, normal. Okay, turn around, come back on your tiptoes. Go back on your tiptoes. Come back on your heels. Alright, go back that way on your heel. Okay, you can sit down for a second. Okay, I'm going to check my note card to make sure I did everything.
That's what I like to do again. Mom, that's what I like to do again. That's what I like to do again.
So with her abdomen, her abdomen, there was no pulsations, and with each area of her body, her skin was equal in color. Everything that I palpated, there was no tenderness, there was no edema, there was no lesions anywhere on her skin. She was able to complete everything within the neurological assessment and the musculoskeletal assessment, and cranial nerves 7 and 12 were intact. Cranial nerves 3, 4, and 6 were also intact. Can I have you say ah? Okay, she's able to say ah, so I know that her soft palate and uvula have mobility, and that is intact. Okay.